Hi, I'm Carrie. Today I'm going to show you what day 2 following adhesive capsulitis surgery looks like. If you remember, in day 1, the therapist ends up showing your caregiver how to do the exercises on the patient. Now day 2, the patient is coherent and can certainly understand and move their own arm. So it's time to show you how to do it yourself. One tool that you're going to need is, this is a T-bar. It's about 30 inches long, made of PVC pipe, and just has a T of about 4, 5, 6 inches long. Other household things you could use is a golf putter, a cane, and sometimes people even use their vacuum cleaner attachments. It doesn't necessarily have to have the small T, but it certainly is helpful. Alright, I'm going to show you 4 exercises. The first one is, just like the flexion that you did yesterday, you're going to lie down on the floor. Today we're pretending my right arm is the involved arm. You're going to grab it with the other arm, bring it up and over your head, and back as far as you can. You're going to feel it stretch, hold for about 30 seconds, and then back off, and continue to stretch until you've met your goal, which is having your arm flat 180 degrees. So it's 180 degrees to my trunk. So that's the first exercise. The second exercise, you're going to use the T-bar. You're going to have your arm tight to your side, elbow at a 90-degree bend, holding the bar and using your other arm to push it down. And keep in mind that the angle shouldn't be straight across your body, but more as if the bar is coming from your opposite pocket. And you're going to push until you feel some resistance and hold 30 seconds or so. Back off and do as many as you need to until you reach the goal again of 60 degrees. The third exercise is bringing your arm up at 90 degrees. 90 degrees here, still 90 at your elbow. Using your other arm, and again note the angle. This time I'm pushing as if I'm pushing from the same pocket until you get some resistance. Hold it 30 seconds or so, back off, and continue to work on that until you've met the goal of about 90 degrees, which would be, if I'm just off the mat, that's about 90 degrees there. The last exercise, you no longer need the T-bar. You're going to roll on your side the best you can. In the early days it's going to be a little sore, so it's okay if you're off of it just a little bit. Your arm needs to be up again at 90 degrees here, and I'm going to use my left arm to push my right one down until I feel some resistance. Back off a little bit and continue to hold it until you've met your goal, which is 2/3 of the way down, 60 degrees, or I'll often say when your fingertips just start to touch, that's about 60 degrees. And for the health of your neck, it'd be wise to have a pillow under your head with this one. One last thing, you'll notice that yesterday we had 5 exercises and today we only have 4. You want to, the snow angel is one that you can't necessarily do to yourself. If you have the luxury of having your caregiver do it for you 2 or 3 times a day, that'd be fantastic just to maintain that. Otherwise your therapist will do it in PT when you're there. And again, these exercises are all done 8 times a day until your therapist tells you otherwise.